Welcome to Public Health Matters, where we talk about matters in public health. It's National Preparedness Month, so in honor of that, we have two very special guests to talk to us about how to be prepared in case of emergencies. Living through the COVID-19 pandemic, it is quite timely, but there's more to do than just in a pandemic. So we welcome our Director of Emergency Management at the City of Nashua, Justin Cates. Thank you, Justin, for being on the show with us today.
Thank you for inviting me.
Tell me, how long have you been with the city and what your role is overall, just so our viewers can get acquainted with that?
So I've been with the city since 2011, going on 10 years now, and our role within the city is really to provide emergency planning services for all of our city departments, as well as our community stakeholders, whether it be nonprofits, businesses, really to come up with a comprehensive plan as to how the city responds to any sort of an emergency. And that's certainly been placed into action over the last few months. When it comes to emergency planning, our role is really to look at those hazards that are natural hazards, technological or accidents, but also human cause or intentional types of emergencies as well. We work closely with public health on emergency planning as well, and that's one of the strongest partnerships that we have in our office and have over the past 10 years.
Mm-hmm. Good to know. Glad to hear it. So you've been there almost 10 years. So tell me, so let's just say 9 years of, let's say, the normal, and then we get COVID-19. So tell me what changed other than, we mentioned before we started the broadcast here that you're working from home now.
Yes, that's correct.
And you're not going into the office, but beyond that, how has the department had to respond during COVID?
Well, I always say that 95% of the work that we do in our office is really planning, training, exercises, the things during blue skies that we work towards to ensure that we're prepared for an event like COVID-19. And that sort of flipped around during COVID-19, where 95% of the work we were doing was emergency response and recovery. And all of our planning efforts really sort of went out the window for the last 6 months. And that presents some challenges to us because we still need to think about all those other hazards that we can experience. We're getting now into the fall season. That's when we typically see the major nor'easters and other winter-related events that cause massive power outages, extreme cold temperatures, and then sometimes we end up opening up a shelter due to extended power outages. And certainly, as you can imagine, in today's environment, opening up a congregate shelter is not really an easy or simple thing for us to put in place. So we have to get back into that planning routine. Myself, as well as a staff of 3 right now, are working on thinking about how our emergency plans need to be revised and adapted to work within the COVID environment.
Mm-hmm. So any ideas, have you come up with anything? For example, what would you do with that extended power outage if people needed a different shelter? I mean, do you have places available where there's limited numbers, adequate spacing, that kind of thing?
So with sheltering, there's a couple of options that we're able to put into place here within the city. The first is normally when we open up a shelter, we normally only open up one just to try and manage our resources. It's easier to open up one rather than spread those resources thin across 2 shelters, 3 shelters, 4 shelters. But what we can do during this event is we could use both high schools, and that way it allows us to spread the dormitory area out, the cafeteria area out, and that's certainly something that requires more volunteers. But that is something that we can explore. The other thing that has been an opportunity for us during the COVID event has been what we call non-congregate sheltering. So in that case, we look to try and, for smaller events, take people who are vulnerable populations and put them into hotels or other spaces that we can use to have somebody stay for a short period of time. And that way they're not in the general sheltering environment. And it also helps to reduce the number of people that really need to be in that dormitory in the gymnasium at a high school. So those are some of the things that we've thought through, but certainly they're not perfect. We're going to have to adapt, especially depending on what our numbers look like related to the infection rate here within the Hillsborough County area when we have to open up a shelter. And if we're in a sort of a bad situation like we were back in the March, April timeframe, we'll have to think about how we would open up and sanitize our facilities if we had to open up a shelter.
So those are kind of things that you really have to keep in mind as going forward.
Exactly.
Hopefully we'll have some time before we have those massive power outages.
Yes.
I know that we've already started with the strong winds from the hurricanes and stuff. We've had a few power outages already in this area, so it is definitely something to keep in mind as we move forward. Tell me when I do want to give a little shout out. So you've had some extra help come along from the CDC Foundation and AmeriCorps, and you've also had CERT volunteers. Can you tell me about some of the additional staffing that you've received because of this?
Yeah, so back in March, we started having discussions with a number of partner organizations about how to leverage additional staff for the emergency response. One of the ones you had mentioned, CDC Foundation, came to us back in the March timeframe and asked, what types of staffing resources could be leveraged by the city to help with the whole slate of different activities that need to be done during a pandemic. And one of the functions that we thought would be a helpful addition would be some emergency management coordinators. So CDC Foundation was able to bring on 2 part-time, for 6 months essentially, emergency management coordinators. And the idea there is they're helping to provide support when it comes to our planning for COVID. Unfortunately, with everything, we could have really used them back in the March and April timeframe, but that was the time that we were actually going through and starting the hiring process, getting the agreement set up with CDC Foundation. And so now we're really focusing on leveraging them to help us adapt our emergency plans to be COVID compliant. Some of the things that they had worked on over the last month have been looking at our extreme heat planning, which typically we would open up cooling centers at some of our community partners like the YMCA or the senior center or the library. And that's something we can't do now because those places have been limited on occupancy and trying to limit the number of outside people coming in. So we've looked at everything, ranging from distributing fans and air conditioners, working with community partners on better planning on outreach to populations who might be vulnerable. So those are all things that CDC Foundation has helped us with. We also had some support from AmeriCorps with a partnership with Goodwill Industries. And AmeriCorps, if folks don't know, is a program very similar to the Peace Corps, but it's domestic in nature, so they're in the United States. And they're focused on providing support to nonprofits and government organizations for a whole range of different community issues, ranging from going and assisting with tutoring in schools to going out and clearing trails in our outdoor areas for people to enjoy. And so AmeriCorps was leveraged significantly during COVID-19 to provide support to organizations. And we used AmeriCorps in Nashua as a way to build up our relationships with the nonprofits in the community who were doing a lot of work during COVID-19. So they actually finished their term of service last month at the end of the summer.
A lot of them were college students
too,
right? They got shorter stints.
Exactly.
Normally it would be a year long, and then they were able to do 6 to 8 weeks, which really was a great
It was perfect.
thing for the city.
It was perfect. And what was nice was actually after they finished their term of service, they actually stayed on as volunteers because they had such a great time working with the city, and they were all in programs like public health and emergency management. And so it was a good opportunity for them to continue to experience this sort of unprecedented event and contribute to their resume when they graduate school, which hopefully they'll do eventually in this environment.
I think they will. We had definitely one AmeriCorps volunteer from your office help us with the clinics, and your CDC Foundation emergency management staff has been really helpful at our clinics because it just takes it's all hands on deck.
It is.
And we have a lot of walk-ins and a lot of traffic control, and we're trying to do it so it's accessible. So there are a lot of issues. So that's been really greatly appreciated on the part of public health to have that help as well.
Absolutely. That's what they're there for, is to provide support wherever needed during this event.
Great. So we're in COVID. We have a COVID lens. We have a pandemic lens, I should say. It's a mixed blessing, I guess, because we will be prepared, hopefully, moving forward. If, unfortunately, there is another event of this type, I mean, you know, this is not to be negative, but it is National Preparedness Month. So, you know, what does that mean, and why is that important?
Well, I kind of go back first about the, you know, hopefully we'll be prepared next time, or we'll be prepared due to this event. And, you know, one of the challenges we deal with in emergency management is it really surrounds what we call disaster apathy. So after an emergency occurs, people are so driven towards whatever that emergency was, and they'll dedicate all their time, attention, and money. And this is not just people and individuals and families, but governments and other organizations. They turn all their attention to that specific incident, and we can't ever be in a situation like that ever again. And as we move further and further away from that emergency, people start to forget, and they start to really kind of get complacent again and not really pay attention to all the things that we talk about throughout the year when it comes to being prepared for an emergency. So I hope that we'll take this opportunity during, you know, the COVID emergency for people to think about, you know, what do they need to prepare as a family or as a business or as a government organization, so that we don't find ourselves scrambling to try and put together the pieces for a strong emergency plan in the future. And when it comes to National Preparedness Month, you know, this has been an initiative that FEMA has promoted for many years, really started to emphasize it after 9/11. And the idea is, you know, for that month to grab the attention of the nation and try and get them rallied around really three big things. And that's making an emergency plan with their families. The second is putting together an emergency supply kit. And the third is figuring out how they're going to stay informed, whether it be emergency notification systems or local media. How are they going to find out about emergencies that occur? And, you know, since I've been in this job, not just here within the city, but working in other emergency management agencies prior to that, I started to really shift the way that I think about emergency preparedness. And in many cases, I don't think it's as simple as just telling somebody, make an emergency plan, make an emergency kit.
Meet by the mailbox.
Exactly. You know, there's a lot more that goes into it. And especially when we think about those populations within our community that need the most help, or may not have the most connections with their neighbors or their family members or friends within that community. You know, those folks may not have the resources to go out and get an emergency supply kit. They have trouble day to day trying to get, you know, the necessary food and services that they need. So it's made me think differently about emergency preparedness and how we can take things a step at a time to help those populations within the community that are going to need the support of the city and the support of their neighbors.
Yeah, so it's a big job. So we're so that being said, you know, we have, what are some of the things that folks can do to, because I look at this, in public health right now, not to say we're in a lull, because we're not, but we have been trending down. We have a little bit of an uptick right now. I wouldn't even call it, no, but a little increase in positivity. Yep. But it's giving us a chance to get back to so to speak, the normal business, what we do in public health. We have a lead conference coming up, for example, and we're being able to bring some of this stuff back. So now we need people to start thinking about preparedness again. Yeah. Not just in, like you said, not just in the pandemic, but how are you going to be prepared if, again, the power outage or a fire or those kind of things, any natural disasters.
Exactly.
So are there any 3 steps people can take, or is that too simple?
Yeah, well, I think the first thing, you know, we talk about when it comes to emergency planning is having that family emergency plan. And that doesn't cost any money at all. We can work as a family to put together an emergency plan to ensure that we know how we're going to reach each other during some sort of an emergency situation if we're all located at other spaces, whether it be at school or at work or at home. It seems like we're all at home now, though, so it's easy for us to keep in contact.
Not all of us.
All of us. But I think that's an immediate first step, is because it's free, it just takes time. And it takes that family to spend a little bit of time thinking about what are they going to do if there is some sort of a significant emergency that occurs. And I think for families, they need to think about what are the types of emergencies that could occur here in Nashua. So we're not concerned about tsunamis. We're not concerned about volcanoes. So we don't want people to kind of go out to those fringes of those events that might not be most frequently occurring. Think about things like power outages and winter storms, the things that we do see on a frequent basis. We're more resilient to those types of things because we deal with them on a more frequent basis.
Do.
But I think a lot of times, as a family, we don't think of all the components that go into ensuring that if that was a long-term power outage or a winter storm that maybe had damaged our property or home and we had to leave for an extended period of time, do we have the ability to do that? So I think that's the first big thing is just work on the emergency plan. When it comes to the emergency kit side of things, there's two different avenues that people typically take when it comes to emergency kits. The one being a go kit. So if you had to evacuate your home pretty quickly because of a fire or some other emergency, what would you take and have available to you quickly to leave? And I think that's something that's reasonable for us to expect people to be able to do, because it's really just a duffel bag with whatever those essential items are that you need. The challenge is the stay kit, and that's when you have to sort of shelter in place for an extended period of time.
That's a bigger duffel bag.
That's normally it's like a big box or something like that we can put lots of non-perishable foods and those types of things. And that's where we start running into challenges with what I call reality. We can't expect everybody to do that, especially if they have challenges, getting food on the table on a daily basis, storing it, all that type of stuff. So in that case, it all starts back with your emergency plan. Think about where you might be able to get food from. Do you have a relationship with neighbors or friends or family members in the area? What about when you go out to the grocery store? Can you get some non-perishable foods instead of just getting all the normal foods that you might get? So that way, at least some of the things there might last for an extended period of time. Even things like water. Knowing about some of the alternatives to getting water, like out of your hot water heater, filling up your bathtub so that you can flush the toilet if you need to, and
which is very important. Now, I live in a town where the power goes out. I'm on a well, so there's no water.
That's right.
And so we get about one flush.
That's right.
And then we're like, we do have a generator, so that is something I will give credit to my husband for checking the generator, every month, making sure it runs, making sure there's fuel in the tank, that it's powering what we want it to. We have very minimal things on it, but we've had to use it, and it's not even winter yet, so. You can see that pre-planning is very important.
And all of that, again, is free. When we think about it, if we can just test our plans, if we can ensure that we're just thinking about what we might do, or even, I always tell people, this is sort of the last resort, is even if you can't afford to go and build an emergency kit, just at least be aware of the assumptions that you're going to have to deal with when it comes to an extended stay at your home and you're not going to be able to go out. And during COVID, I tell people 72 hours, which is the time frame that we tell them that they might have to stay in their homes and they should have a kit for those items. 72 hours would have been nothing.
Right.
A lot of people are still sort of sheltering in place. And so if it wasn't for the food delivery services and those types of things, a lot of people would have been in a big jam. So again, I tell people, and don't think about 72 hours. Think about, how long will it be sufficient for you to have some items on hand that you feel comfortable that you'd be okay to stay in your home. And then after that, knowing where you would be able to get support or services beyond that. It's been such a challenge trying to convince people to build these kits for so many years. And so what we've thought of is just, at least work with the emergency planning, and that's free. It's something that everybody can do, and just take the time with your family to work some of those issues out.
You mentioned, I'm just going to interrupt because you mentioned family, but I also want to mention neighbors.
Absolutely.
Because during COVID, when in the beginning, when we were all really home, I buddied up with a neighbor.
Yeah.
And so we didn't all go to the grocery store. I got her stuff one week, she got my stuff the next week.
Yeah.
But just as an example, using your community, leaning on your neighbors, and have that kind of plan in place so that not everybody's going out. If there is a surge in this, or regardless, just community so important
Exactly.
during this time.
It is, and that's been another challenge, for so long, has been we a lot of times don't know our neighbors anymore. It's a different environment, I think, and that expectation to be able to see that sense of community in our neighborhoods across the city or across the country, honestly, it's challenging because there's evidence that shows that having those social connections within your community do help you get through a disaster. In so many cases, having that ability to check in on an elderly neighbor, that's a big, big deal when it comes to emergency management, because we know that if people can check on their neighbors, it now limits the amount of work that firefighters and police officers and those folks need to go out and check on these people.
And then they're free to do
other things, which could be a big emergency. So, yeah, it's so important. And again, that's a free thing to do. Go out and meet your neighbor.
We like free.
Yeah, and that's something that I think anybody can do is, get to know their neighbor. And trust me, that's going to be a big part of your emergency planning. It's a big thing for us to do as a community to really ensure that we're prepared for the next major emergency.
Yeah. So we have this Greater Nashua My Emergency Action Plan, and we also have a slide that we can put up for a second, and that can be found. I believe they can access it from our website as well.
It is on the city website.
It's on the city website. It's a great book. It just kind of step-by-step guides you through emergency planning, how to develop a plan, how to evacuate, all of those things. So speaking of a free resource, you can contact Public Health or the Office of Emergency Management and get your hands on this great booklet. We also have some inserts for that booklet, kind of particular to the elderly population or to families or other groups. So please feel free to reach out for that as well.
And that's, I think, a good resource for folks, because in a lot of times, I'll tell them you need to make an emergency plan with your family. They say, where do I start?
Right.
Well, that resource is a great place to start, because it really guides you step by step through the process to say, well, do you know where your medications are if you had to grab them and leave quickly? What other supplies do you need to bring with you if you maybe have medical supplies or things like that if you had to evacuate? And again, all that just takes some time just to go through a guide like that, so that way you have thought through it and think, all right, well, if there is an emergency, I know what to do.
Right. So we've got a lot of resources here. Thank you so much, Justin, for coming on and talking about preparedness.
Absolutely.
So important, and thank you for the work you do to keep our community ready. It's been a challenge.
It has been.
But I think, with a lot of partnerships, and I do also appreciate that you reached out to a lot of the nonprofits and that are really keeping a lot of communities afloat during this time.
They are.
And so I appreciate your support of that. It keeps our public healthy. And we wish you luck as we continue. And I know our paths will cross again, because sometimes I see, so we'll see you in the streets or wherever it is.
Yes.
Right.
We'll definitely continue to work, not only during the COVID situation, but we'll continue to plan for other types of emergencies that not only has our city seen before, but those hazards that are not as frequent, but we need to be prepared for here within Nashua.
Absolutely. All right, thank you. We'll be back with a CERT volunteer from the city of Nashua.
Disasters won't wait for a pandemic to be over. So while your family is home more often, make a plan in case you have to deal with coronavirus and a natural disaster at the same time. Ready.gov/plan has the educational tools and resources to help your family prepare for emergencies and find information on how the coronavirus may affect your plan. Disasters won't wait, neither should you. Make a plan with your family today.
This message is brought to you by the U.S. Fire Administration. Have two ways out. When fire strikes, deadly smoke can fill your home within minutes. That's why the USFA wants you to plan and practice home fire drills. Draw a map of each level of your home showing all doors and windows. Discuss the map with everyone who lives with you. Practice your home fire drill at least twice a year. Make sure all doors and windows that lead outside open easily. Push the smoke alarm button to start the drill. Try feeling your way in the dark or with your eyes closed. Have at least 2 ways out of every room. If your first way out is blocked by fire or smoke, you can use your second way out. If there is smoke, get low and go. Crawl quickly under the smoke to your nearest exit. Close doors behind you and gather at a pre-planned outside meeting place where first responders can see you. Call 911. Remember, get out and stay out. Never go back inside for people, pets, or things. Learn more at www.usfa.fema.gov.
Welcome back to Public Health Matters. We're still talking about emergency preparedness, so I'm back here with John Watkins, who is a CERT volunteer, the Community Emergency Response Team for the city of Nashua. Welcome, John.
Thank you for inviting CERT. We really do appreciate the opportunity to get our message out.
Sure. Well, we appreciate the work that you do in the city.
Thank you.
And in Greater Nashua, really.
Actually, Greater Nashua area, right?
Right. So you yourself live in Hudson, you
I
told
do.
me. I hope that was not too much information to reveal.
No. Actually, we like to pride ourselves on the fact that we term ourselves zip code agnostic.
Oh, very good.
We have members from Tingsboro, we have members from Manchester. Predominantly, we're Nashua-based, Nashua-based people, but we'll train anybody. If you want to come help us, you're more than welcome.
So tell us a little bit about what you've done in CERT, how long you've been involved, and
I started about 6 years ago. I went to my first basic training. I was really enthused about the training, about the work that the CERT team was doing, right? We were a lot smaller then. I liked it so much that I actually went to the Emergency Management Institute and got trained so that I could train other people on the CERT process. We have two main tenets. The first one is education and training, right? And then we act as a force multiplier for the professionals in the region. We will supplement police departments with situational awareness, right? We'll work with public health in vaccination clinics and things like that. We work with Justin's team on setting up shelters, but our primary thing is education. You talked earlier about making a plan. We will help you make that plan, right? In our training, we will give you ideas on things to have in your plan, right?
so whether you're a CERT volunteer or not, the training is very beneficial.
Absolutely. We can't train enough, right? And Justin mentioned it. Our feeling is that if I can train you to take care of yourself in an emergency or an event, right, then I don't have to come get you, right? Because another part of our training is we'll teach you how to do search and rescue. We'll teach you how to do medical triage. We'll teach you how to run med ops and other items, right, that go along to saving lives.
Mm-hmm. Wow. So besides getting the preparedness, it's a great volunteer opportunity for people that want to get involved.
Absolutely.
Can you just tell me, and we won't dwell on this even though we are in a pandemic, what were the CERT volunteers able to do to contribute during the pandemic?
Great question. Thank you for asking. So when the governor issued the announcement that they wanted to set up ACS, alternative care sites, and this was in preparation for hospital overflows, where there were so many patients that the hospital just couldn't take anymore. City of Nashua set up Nashua South High School as an alternative care site. Our team collected inventory from warehouse, right? We transported the inventory from the warehouse to the alternative care site. We set up the alternative care site with the aid of the National Guard, and that's cots and IV stands and things like that. Inventoried everything. We set up hot zones and cold zones, so where the staff members can go without being in danger of picking up the disease. We tested ventilations, right, to make sure that we weren't cross-ventilating air. we extensive hours in setting up this alternative care site. And then fortunately, we trained on how to staff it, right? Fortunately, it was never activated, which is a good thing.
It is a good thing.
Yeah. And
you're ready for, Justin,
well,
you heard, if it happens again,
we know how to do it.
You know how to do it, yeah.
Right. And then we actually assisted in removing it, taking it down, and putting all of the inventory back into storage so that we know exactly what we have for inventory, right? We know exactly where it is. We know exactly how to get it and how to stage it and so forth and so on. So in the preparedness thing, we think we're prepared.
Yeah, absolutely.
Okay.
You think it's almost training for the next time.
Yes, yes. And then we've helped with the COVID-19 testing clinics.
Testing clinics, yes.
Yeah. So we do the logistics behind that, traffic control, traffic management, a lot of the paperwork, behind the scenes.
Right, and I actually had the pleasure of working with a few CERT volunteers at the clinics as well.
Oh.
Because we
I
really
hope we performed admirably.
did very well.
Okay.
But it's one of those things that you're trying to set it up in a non-traditional place.
Yes.
So whether it's a church parking lot or now we're in the Elm Street parking garage,
Right.
You're just trying to be in a place where, this is not like, what we would consider normal. People are getting tests in their cars or they're walking through, and keeping those zones safe was really critical.
And that's always a challenge on how to properly set something up that makes sense, right? Traffic flow. Where do you get your supplies from, right? Traffic comes this way, supplies come this way.
Right.
That's another thing that we train on, and that's called a point of distribution, right? So hopefully, if and when a vaccine shows up, we'll be ready to set that up, so that we can get the greater Nashua population vaccinated.
And we were talking to that a little bit before the show. We call them pods, points of distribution, or I guess points of dispensing. It's the technical public health term, but
Right.
An acronym works the same way with this in this case. So that will be something that's probably on your radar right now as CERT volunteers.
We are training for it.
Oh, excellent.
Right.
Excellent. So we're not doing a lot of things in person right now. I'm sure your trainings are not in person right now. What you've mentioned to me is that a lot of this training is hands-on.
Yes.
It's a lot of physical work.
Yes.
So what can a person do if they want to get involved with CERT and still be trained and contribute? Because we still need people.
Yeah, so first of all, let me just jump back, right? Yes,
Okay.
there is physical work, right? But there is a role in CERT for everybody,
Okay.
Right.
Good to know.
right? It doesn't matter whether you're the big burly guy that can go through a building and haul a body out, or hold a survivor out, or whether you don't want to do that, you just want to do paperwork, all right? Quite frankly, I'm not very good at paperwork.
Yeah, I say I'd be the paperwork person.
So you do the paperwork, I'll go into the building,
Yeah.
right? But there is a role for everybody. So we welcome everybody, right? Because we'll find something for you to do. But our training, we teach people, the first part of our training goes back to what Justin talked about and being prepared, making a plan, right? We will help you make a plan. We will actually help you build your go kit, right? Things that you might not think about that should be in your go kit, we'll kind of remind you of.
So
right?
Remind us now
Oh.
about a few more things.
Well,
'cause
Justin
Justin
talked about-
touched on it, but he didn't really go.
Yeah.
I'm always looking for some pointers.
Medications is one thing, right?
Yeah.
Definitely medications, all right? But having the proper clothes, right? And having decent shoes, lighting, flashlight. I personally recommend a headlamp, right? Because it keeps your hands free. But that type of thing. A radio, Justin talked about communications, right? Understanding, listening to the radio, finding what's going on, right? Another thing is energy, right? Energy bars, I like raisins and peanuts, right? But energy, water, right? And then the two things that I think that a lot of people will forget about, right? One is entertainment. If you have to leave and you're going to a shelter or a hotel room or friends and neighbors, chances are power's going to be out. And you talked about power outages,
Absolutely.
right? Recommend a deck of cards.
I was just going to say a deck of cards.
A deck of cards.
Uno, you know.
Well, yeah, but a deck of cards. Look, kids, right? You can play war. You can play
Fish.
Go Fish, right? The adults
Yeah.
can get into spades, hearts, poker, right? So entertainment, just something to keep you occupied, something to keep your mind off of the traumatic experience that you're going through. Remember, you had to leave your residence.
Right.
And then the other thing I like to talk about is comfort. Pack something away that gives you comfort, right? Some people like chocolate, right? So put chocolate bars in there. Put a box of wine. If you're a wine drinker, put a box of wine.
You've already hit 2 of mine.
Huh? Yeah. So put those in there because when you get to where you're going, right? And that's actually part of the plan, right? Have a plan. Know where you're going to go, right? Should you have to evacuate, your home, right? Have that plan. But when you get there, right, you need to chill. You need to relax, right? And having those comfort items, right, will go a long way in bringing down your stress level. So
that's
those
great
are things that we
advice.
talk about.
Yeah, that's great advice. So, of course, we got off the topic of why you would want to be the CERT volunteer and what you can do now,
Yep.
given that the trainings aren't in person. So let's just circle back maybe to that.
Yeah, we do. So we're working now with points of distribution, right? We're also, so I just lost my train of thought here. Ask me the question again.
What you can do now to
Yep.
become a CERT volunteer and first, what you're working on now, which is the pods.
Right. So we do pods, and we also do a lot of other training, right? So we have a class on what we call Until Help Arrives, right? And in that class, we teach people what you can do in the first 6 to 9 minutes, right?
Okay.
If you come upon an accident, right?
Okay.
How to stop bleeding, how to check airways, things like that. CERT members, the sky's unlimited,
Okay.
right?
So is that a course that you're offering virtually right now, or?
It is. You can go to the Nashua website and sign up for it. We have offered it a couple of times virtually, but again, it's one of those things that's better, with hands-on.
Right. So again, going back to if someone in the community would like to become a CERT volunteer now, you're not having these hands-on trainings because we're not really doing much in person these days.
Right.
What can they do? How can we circle that so that you still have the volunteers you need is what I'm getting
So
at.
they can sign up, right? They will go on a mailing list, right? And we will notify them at the very first possible training exercise that we have, whether it's going to be virtual or whether it's going to be hands-on. That all depends on what we do going forward.
All right. And you mentioned that when COVID first started, the governor put out a call for volunteers, and there was a way to get some kind of certification.
Yes, New Hampshire Volunteers, right? If you go to that website and sign up, you'll have a choice to join the Nashua CERT team. We have 88 members right now.
So you mentioned 88 members, but you also mentioned me before this started that we have 210,000 people in this community.
Right.
So you need more help.
Yes, we do. Yes, we do.
Yeah.
We, like I said, we zip code agnostic, so we don't care exactly where you live. We don't care status, right? If male, female, there's a role for everybody. Let's just say that.
Great. So I hope we'll get some people to look into this.
That would be great.
That they watch the show. Just some real emergency management kind of things. You did. Can you explain to us the difference between alerts and watches and warnings? Because we are coming upon, power outage
That's a great
season.
question. So first of all, City of Nashua uses Code Red. So you could sign up for Code Red on the website. It's really a great app, and you will get notified when there is an emergency situation in your area. FEMA has a wonderful app that's good for smartphones on both sides. And I really like the FEMA app because you could set in multiple zip codes, right?
Okay.
So if you have friends or relatives or maybe an elderly, parent living somewhere else, right, you can keep track on them by putting in their zip code. And FEMA will tell you what the situations are. But being alert, understanding what's coming, right? Understanding that there is a tornado alert in your area, right? That means that situations are right, that for this to develop, right? That will transfer into a watch.
Okay.
Right? And a watch is, we really think this is going to happen, right? And then the warning is, it's happening,
Okay.
right?
Take
It's happening.
shelter.
Right, take shelter. And each one of those, in your preparedness plan, right? Each one of those has a different meaning to different people, okay? So understanding what a watch means to you, right, can go a long way into helping you get through the incident. Understanding what a warning is will go a long way to help you get through the incident. I like to tell people that when there's a storm watch, there's a storm coming, right? Go get gas. Use that watch as in your plan, right, to go get gas, right?
That's a really good point, because a few years ago we had a storm that knocked out the power in the area. You couldn't even get gas.
Right.
I mean, the gas stations had no power, so
Right.
they couldn't pump the fuel.
That's
and
right.
who would have thought, that there'd be gas lines in Nashua?
So
but
often
it's
I
very
see people
real.
go, when there's a storm coming, people will run out and buy bread and milk, right? And then the power goes out and they can't keep the milk cold.
Right.
So think about it in your plan. Go get things that you would normally use, right? Go get gasoline. Because if the storm passes, you still have
You
gasoline.
haven't wasted anything,
Right,
right? You
right.
still have your gas.
Right.
Well, this is great. This is really interesting things. Is there anything else you want to impart to people about preparedness? This is Preparedness Month.
Yeah, Justin said it, and it's have a plan, right? If it's 2 a.m. and you're in the middle of a blizzard, and for some reason or another you have to evacuate your house, right, or your home, now's not the time to think about what I need. Right? Now's not the time to think, I need my medications, I need I need clothes, I need this. This is why you make that go kit, go bag, right, prior, right? So when that happens, you can grab. You don't have to think. Everything you've already thought about it. Everything that you need to take with you is already assembled.
Right.
Okay?
So you're planning with a clear head.
Yes, and I have to mention this. Don't forget your pets. Okay, if your pet has medications, pack those too.
Okay.
Right? Take something that can control your pet. Because if you need to go to a shelter, right, a lot of times the pets are kept separate. Right?
Okay.
So you need to think about that. Know where you're going. Have a plan. This is where I'm going. I'm going to go stay with my relatives, or I'm going to go stay at the hotel, or I'm going to go there. Also know multiple ways to get there. Right? Because the way that you would normally go from my house to your house, right? I might not be able to go that way, right? So do that and tell somebody, right? Develop an out-of-state contact, right? Somebody that you can call and say, hey, look, we need to go, right? We're going to so-and-so. We'll call you when we get there, right?
Right. And that goes back to the whole community thing. Even if it's beyond our state borders, you want to be in touch with people and don't work in a vacuum.
Yeah, exactly. And I have to mention this. In CERT, we have a phrase called me, we, they, right? Which means we'll teach you how to take care of yourself, right? Because you need to take care of yourself first. If you're injured or if you're hurt, you can't help anybody else, right? So that's the me. The we is your family, right? Make sure that you could take care of your family's safe, everybody's good, and then you go to they. And with they, you talked about your neighbors, right? Go check on your neighbors, work with your neighbors, right? And then in a CERT role, in a CERT volunteer, should we be activated, right? Then you go out into the greater community itself and you start to help people in the greater community. That's what we do.
It sounds great, and it sounds like I have a lot to do tonight with my family. Maybe over the weekend, a weekend
No,
planned.
don't put it off.
No, I mean, well, I don't think it's going to happen right after dinner tonight, but
Okay.
maybe this. But it does sound extremely important. You know, we have kids, we have a pet, we have all these things, and you know, we have had these power outages and that kind of thing. So I just want to remind people that you can get a copy of this online, and that's on the public health website and also on the emergency management website. And I also want to I want to thank John for coming.
Thank you.
Please sign up to be a CERT volunteer, and you'll be notified when a training in person is starting again. But there are some virtual courses that you can take in the meantime. We're a community. We need all the help we can get. I do want to remind people that we do have COVID testing every Tuesday from 3 to 5 p.m. in the Elm Street parking garage. You can also sign up online right now. You can go to the Division of Public Health and Community Services website, or you can call 589-3456 and speak to someone on our COVID hotline, and they will sign you up for an appointment. Thanks, everybody. Have a great week.